Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek Da Silva. Be honest now, how many times have you seen someone that's had some work done and you say to yourself, what were they thinking? The truth is, we see people all the time, especially on TV, who now look like a caricature of their former selves thanks to an overzealous plastic surgeon or dermatologist. Our first guest says any plastic surgery procedure can look fake if it's overdone, but by the same token can look great if it's done properly. Here to talk about it is Dr. Parham Ganchi, a Harvard-trained plastic surgeon who has been named one of the top plastic surgeons here in New Jersey. Great to have you here.
Thanks for having me.
So there is a fine line between just right and overdone, is there not? Can you just tell us what that is?
Oh, absolutely. I mean, it's kind of human nature. When we see something that we like, sometimes we think, well, why don't we get more of it? And if we do more, that's going to be better. And that's where your surgeon should be guiding you. And so listen, you know, this is where it looks great. If you go too far, you're going to ruin the whole thing. So let's stop right there.
Our society is obsessed with looking good, staying young, doing all of those things. What do you say to people when they come to you and they don't look so bad and they want these procedures done? How do you direct them? How do you guide them?
Well, first I try to find out what it is they're looking for and give them the options. You know, these are the things that we can do. We want to make you look natural. If there's certain things that we can do to tweak things, make you look a little bit better, great. But realize what we can do and don't go beyond that. Be realistic in your expectations. You know, you're not going to look like somebody else. And if you want those things that we can do them safely, then absolutely. There are a lot of really nice options.
Is plastic surgery being overdone in this country?
I think so. I think it's part of our media, it's part of our culture that people seem to want to overdo things, but I think it's mostly in a select group of people. I think the average person that comes to my office is not looking to be overdone. If anything, that's what they're afraid of. They're thinking, you know, I don't want to look like that person on TV. I want to do this in a nice way, in a very natural way. So I think we're seeing the overdone people, but the ones who were done well, you don't see them because they blend in, they look nice, they look natural.
What should people look for in a plastic surgeon when it comes to these procedures?
Yeah, this is a very important point that a lot of people don't spend enough time on. There are several things. If you're going to have plastic surgery, then of course the first thing is make sure the person is board certified in plastic surgery and not some other field. Second, make sure they've gone to the best programs for their training, they're at the top of their work, and that, you know, they're the best for what you want done. Second is make sure they're doing the kind of plastic surgery that you want to do. If they're doing hand surgery but you want to have a facelift, that's not the right person for you. So they should be doing a lot of what you want and have a lot of pictures to show you about it. And the final thing is, just like with anybody, make sure you get along with them. You have a good rapport with that person, that they're going to be there for you to help you in the recovery. And I think that's the package you need to have a good plastic surgeon with a good result.
What about a prep? I mean, you know, before we came on the air, we were just briefly talking about prepping people, getting them ready. And not only internally, you know, making sure their nutrients are right and all of those things, but even psychologically. Is that part of the something that people need to do?
Oh, absolutely. I think too many people want to come in, have it done and leave and have it be perfect. And I think that's too quick and it's not the right way. If you do it the right way, you give it some time, you prep yourself physically, emotionally, you know what you're getting into, you know what you're going to get out of this. I think that's the best way, and then you get the overall nicest results.
Now, you brought some pictures for us of befores and afters of, you know, maybe things that have gone wrong. So let's just talk about these. Would you please just talk about what are we looking at here?
Sure. This is a patient who was trying to save some money, and I think that you don't want to skimp on plastic surgery in your body. So she went to South America to have buttock augmentation, which is a very popular procedure in this area. Implants were placed in her bottom. You can see the shape on the left doesn't look natural at all. They're too high, that doesn't look nice. Anybody looking at this would realize this is not normal. So we took her and basically took the implants back out, put them in the right position without leaving visible scars. So now she looks natural, and she's enjoying that result.
And then our next one is of the eyes, and we need to get through these. So the next one that's coming up is a picture of some eyes.
This is an example of someone who had lower eyelid surgery, where the eyelid has been pulled down. A good plastic surgeon can not only do the procedure with less complications, but also fix the complication if you have that. And this is an example of that.
And then the next one we have is a picture of lips.
Lips.
I think this is the biggest mistake that women make.
There's so many people who overdo lips, and here she had done several procedures, got a big bump on her lip. So all we had to do is remove that bump, not leave a scar, and fix that smile line on the left side of her face.
Yeah, that actually looks really good. And the last one is the nose.
The nose, again, she went to South America, had her nose done, overdone nose, has these 2 bumps, look like little horns in her nose. We had to go back and do a combination of a reconstructive and a cosmetic procedure to give her a much more natural result.
Wow, it's amazing what people have and what people need to be careful with. So the bottom line here, choose the right plastic surgeon, make sure they're board certified, make sure they've done all of this stuff.
Make sure they do what you're looking for and look at the results, and then, you know, take the time to do all this. Don't skimp on this. And these people who want to save money ended up spending more money fixing the original problem.
Thank you for joining us.
Thank you.
Thanks for the great information.